referred to as the anatomical position. And notice that in the anatomical position, we have the individual standing almost at attention with the palms facing forward. So this is when we talk about limb anatomy. The other thing that is important is the reference between proximal and distal. Do you remember what the difference between proximal and distal is? Say the elbow in reference to the shoulder joint. Is that proximal or is it distal? The elbow. So the elbow is distal. So if this is our elbow joint, then the elbow joint is distal, meaning at a distance from is another way to think of it. So it's distal to the shoulder joint. Okay. And then proximal is a reference point which brings us towards the core of the body or the axis of the body. So we have proximal and we have distal. Okay, so if I were to ask you, where is the elbow in relationship to the hand? Proximal, yeah. And then if I say, where is the elbow in relation to the shoulder, you would say that it's distal. That's a very good, that's also an important reference to know. Plane should remind you of the word crown. So a coronal plane would be a plane which is located here. So typically we use that in reference to the head, the skull, when we're talking about skull anatomy. So coronal, like a crown, which I'm trying to draw here in white. So that would be a coronal plane if we were going to look at, for example, the posterior aspect of the skull versus the anterior aspect. So sort of think of it as a crown, a plane which reminds you perhaps of the positioning of a crown. So we've got this plane. Perhaps I can draw it a little bit better. So a plane which would be slicing the skull from front to back would represent that coronal plane. A represents what type of tissue? Do you remember that? What type of tissue? Does it look like skin? Does it look like epithelial tissue? Does it look like muscle? Does it look like nervous tissue? So if I were to give you, I'll give you a couple of choices here. Skin. Yeah, this is skin. Okay. This next picture, and skin is an example of epithelial tissue. Connective tissue is the other tissue that you need to know. And when you compare the two, you notice that quite close to one another, with little or no space in between these cells. And so we see the cell and the nucleus of the cell. Connective tissue is different. The first thing you notice about connective tissue is that there's quite a bit of space in between the cells. So we see a cell here, and then we see a cell here. We have quite a bit of space in between. And that characterizes this connective tissue, that there is open space. You almost get the sense that the cells are floating within a gel matrix. So we can easily identify connective tissue because of that microscopic anatomy, which is unique to this tissue type. So we have two types, two components that make up this connective tissue. We have what appears to be the cell component and open space, which then has these structures that appear as cords or bands. And this is an important part of the connective tissue because it provides structure to the connective tissue and support. So connective tissue is typically a supporting layer. Skin, which is an epithelial lining, will be on top, lay on top or on the surface of this connective tissue. So this underlying matrix, connective tissue, supports the epithelial layer, which covers and provides surface. So we need to define what these other parts, so I'm going to switch over to another color so we can pick out some of these connective tissue, this connective tissue fibrous material found here and here. We'll make that red. And make that a little bit more, and you see it kind of appears, sometimes it appears thick, sometimes it appears thin, sometimes hair, very fine, thin in appearance, lacy, sometimes almost rope-like. So the types of cells that we find within the connective tissue are the cells that make some of this connective tissue. And the two common cell types are fibroblasts, and they make collagen, and a cell type known as the chondrocyte. And chondrocyte makes collagen, chondrocyte makes cartilage, and fibroblasts typically make collagen. And they make other types of proteins and matrix components as well. But those two in particular, I want you to remember. So collagen and cartilage, and the two cells that produce those two connective tissue components. The other things that we find in the extracellular matrix are immune cells. And examples of immune cells are macrophages, dendritic cells, and other cells that can fight tissue or microbes, foreign invaders that breach the epithelial lining. This layer is particularly good at getting rid of those microbes, phagocytizing those microbes or killing them. And also important is the ability of this tissue matrix to accelerate or amplify the immune response. Okay, so we've got, and so we've talked about the cells and we've talked about the matrix. So collagen and cartilage. One other type of component that we find in the extracellular matrix is referred to as proteoglycan. So proteoglycan, kind of an interesting word. If you look at the word, it looks like pro, like the word protein, and glycan should remind you of the root word for sugar. So this is a macromolecule which is found in the extracellular matrix that's very important for the structure and overall substance of the extracellular matrix. It's literally a macromolecule of protein and sugar that adds charge to the matrix, and it also has the ability to hold water, to hydrate the extracellular tissue component. So we don't want to forget proteoglycans. They're very important. Another component, particularly in the extracellular matrix of the skin, is called hyaluronic acid. Which we hear a lot about lately because of its importance in maintaining the skin as a beauty product. Hyaluronic acid, it's very important in holding water and hydration. In addition to collagen, I want to add elastin. So that's another important. And we have a few additional proteins that are important for adhesion that are found in this matrix. So we have some adhesion molecules, and they are laminin is an example, and fibronectin. So these are important in your connective tissue matrix. Okay, so skin, A, connective tissue, B. Do you recognize C? Muscle. And if you had to guess what type of muscle this is, what is that? Second choice? What are the three types of muscle? So skeletal muscle is the muscle that we find. Where do we find skeletal muscle? Right, good. And so skeletal muscle is important for voluntary muscle action. So voluntary muscle action. In other words, walking, picking up a pencil, typing. These are all functions of voluntary muscle. The second type of skeletal muscle that we'll talk about is smooth. And where do we find smooth muscle? Smooth muscle is found in the internal organs, and it is involuntary. So give me an example of a muscle in the body that makes up the internal organ of the body. The heart is another example of muscle, which is cardiac muscle. It actually gets its own category. Give me another example of smooth muscle that makes up an internal organ. The kidney is different. Give me another internal organ. Liver, these are all cells. How about the stomach? Okay, so the stomach, the small intestine, the large intestine, the bladder, okay, rectum. These are all organs that have a primary function that are largely made up of smooth muscle. The other organs that you mentioned have a large cellular component, but not a large smooth muscle component relative to these others that we talk about. So, and we'll talk a little bit more about those when we get to GI. So these organs that are largely, their function is, their role is primarily volume capacity in the case of the bladder, but also has the ability to stretch and contract. The stomach, which has a primary role in mixing and churning. The intestine, which has a primary role in propulsion. So these are all smooth muscle organs. The last muscle, so like I said, the cardiac muscle is a special, it actually has its own classification. So we have skeletal muscle, smooth muscle, and cardiac. And only one organ do we speak about when we talk about cardiac muscle, and that's the heart. And cardiac muscle is unique. It is involuntary. It is an involuntary muscle. It has a unique capacity to, it's autoarrhythmic, meaning that it can stimulate contraction in the absence of neural stimulation. So it's autoarrhythmic, and we'll talk about the pacemaker potential of the heart. So 3 muscle types that you need to know. 3. They all look different on the microscopic level. And so this muscle here that is shown is smooth muscle. Okay, and I know that based on the appearance of the muscle. And so if I look at the smooth muscle, I will go ahead and point out that smooth muscle cells are spindle shaped. They have this large nucleus, single nucleus, centralized nucleus. And these cells look very much like fibroblasts, but they look like thin spindle-shaped cells. Skeletal muscle cells look different. Skeletal muscle cells, we will see them, and they are cells that are long cylinder-shaped cells. They have this appearance, and they are made up of sarcomeres. And they are characterized by being quite long and multinucleated. So they look very much like this. And if you look at them closer, they have a microanatomical feature referred to as a sarcomere, which characterizes the skeletal muscle. And then cardiac muscle looks a little bit different than, they are not spindle shaped. They're similar to skeletal muscle, with the exception that they are branched. So skeletal muscle looks like this in appearance. And they have a characteristic feature between the cells which connects them, which allow for rapid electrical transmission, and that's referred to as an intercalated disc. I'll draw their nucleus right there. Intercalated disc. So that characterizes the skeletal muscle cell. So they all look different. So the smooth muscle looks like this spindle shape. That's what a smooth muscle looks like. So all 3 cells look quite different from each other. So I can immediately look at C and say, recognize it as muscle, as you did correctly identify, and I can say further, this is smooth